I'm Dr. Mohit Shete. I'm an orthopedic surgeon specializing into arthroscopy and sports medicine. I am attached to multiple hospitals in Mumbai and Thane, Jaslok Hospital, Breach Candy, Reliance Hospital, Zainava Hospital, Critical Asia Hospital, Apollo Group of Hospitals and SRV Hospital. So today we shall be discussing about the common injuries in the knee. This is a bone sample of the knee. This is how the knee looks from the front. This is how it looks from the sides. So I'll be discussing about the common injuries in the knee. So there are few structures to be known. This is the lateral ligament, that's the inner ligament. There's a ligament in the behind that is called as the posterior cruciate ligament. This is the posterior cruciate ligament. And there is a ligament inside the knee that is called as an anterior cruciate ligament. The blue color structures that you see are called as the meniscus. That's the inner meniscus. This is the inner meniscus and that's the outer meniscus. So the common injuries that involve the knee are the meniscal injuries and the cruciate ligament injuries. This meniscus, the blue color structures, they act as a cushion inside the knee, and the cruciate ligaments, which is one in the front and one in the behind, they give stability to the knee. Whenever a patient injures the knee, either he injures the meniscus, the cruciates or the ligaments around the knee. So how do we treat it basically? Initially we treat it with RICE therapy, that is rest, ice, compression and elevation. If the patient is symptomatic and doesn't get better within 5 days of injury, we usually give few anti-inflammatory medicines and ice packs. Another 5 more days of injury, if the patient is still not better, we do an X-ray and MRI of the knee to diagnose the grades of injury. There are 3 grades of injury in each type of the ligaments. Grade 1 is the least injury and grade 3 is the maximum injury, which indicates a complete tear. This injury usually happens in young players, sports persons and patients who develop road traffic accidents. So the treatment wise, like I told you before, RICE is the first treatment. Second treatment is anti-inflammatory medicines. If still the patient is symptomatic, we do an MRI, we find out the exact diagnosis and the grades of the injury. Grade 3 injuries most of the times require surgery. So there are different modalities of the surgery which are available, right from partial meniscectomy to meniscus repair, anterior cruciate ligament repairs, medial meniscus, lateral meniscus repairs, posterior cruciate ligament repairs, the lateral collateral ligament repair, the medial collateral ligament repair, patellar tendon repairs. These all surgeries are done by cameras. So what do you mean by a camera? So these are like a keyhole surgeries wherein it's just one stitch on either side of the knee. So it's a minimally invasive approach. The patient's recovery is very fast, the rehabilitation is good, and patient goes back to his normal activities within a period of 9 months to 1 year. Patient requires physiotherapy post-surgery, and till now I have operated approximately around 4,000 to 5,000 ACL reconstructions and meniscus repair surgeries. I wish all my patients a speedy recovery, and for any further problems, any further doubts, any further queries, you can always consult me. You can always contact me. I am always available. Thank you very much.